There are a small percentage of my patients who will have a side effect on a statin or cholesterol pill. That often will manifest as either an ache in the muscles or an abnormality in the blood test, either the liver function or the muscle enzyme. The good news is that this is usually reversible. This can be reversed by stopping the medication.
Initially, when these drugs were tested, they were tested mainly in men. There was less data in women over the years, but we have in this day and age conclusive and good clinical trial evidence that statins save lives in women.
In a surprise move, the American Heart Association recently abandoned the cholesterol targets that help doctors decide who should get a prescription. What's even more surprising is the effect this could have on statin use.
After the most recent statin guidelines came out from the American Heart Association, it was estimated that if these guidelines were followed, about 1 billion people worldwide would be prescribed statins.
What the American guidelines have said is, we've tried lifestyle, it hasn't worked. So we're going to move ahead in society and use a drug that's effective. It is true that statins will save lives if I prescribe them to more Canadians. But I still want to use the art of medicine. Take a history, make sure your risk really is high enough to be on that statin, and make sure you're making the right lifestyle changes as well.
While statins remain the drug of choice for lowering cholesterol and reducing risk, there is still something puzzling about a significant number of heart attack victims.
What's interesting is that 50% of people who have a heart attack or a stroke actually have normal cholesterol levels.
Cardiologist Paul Ridker has a tennis partner who fits this description. A few months ago, the man nearly dropped dead from a heart attack while jogging. He was fit, healthy, and had lower than average cholesterol levels.
The question has been, what in addition to cholesterol is driving this process?
In the 1990s, Ridker and his colleagues began to follow a trail of clues that began at the site of the heart attack itself. It's where scientists had noticed signs of inflammation.
Inflammation broadly is the mechanism by which our bodies fight off foreign substances, fight off infection, help us to deal with cancer. You can't live without inflammation. The problem is, for some of us, that inflammation can be overactive. And we ask the question, is it possible that in currently healthy individuals, was there a measure of inflammation in their blood that we could get a grasp on that would tell us 5, 10, 15 years down the road, aha, this person is at high risk because they have a pro-inflammatory response, just like they might be at risk if they had a high cholesterol level.
So Ridker tested blood from heart attack victims. He was looking for markers of inflammation. If he found one of these markers, he would have evidence that inflammation was at the scene.
And it turned out something called C-reactive protein, or CRP, was a very powerful predictor of your risk of having a future heart attack, even if your cholesterol levels were low, and it was a light bulb going off for us.
But could stopping inflammation actually help stop heart attacks? Ridker looked for answers by investigating another mystery, an unexpected statin side effect.
Investigators around the world had noticed that the statin drugs, these cholesterol-lowering drugs, also lower the risk of stroke. And that's a little bit unusual because stroke is not really driven by high levels of LDL cholesterol, but it is driven by inflammation. And we already knew that statins lowered the risk of stroke, and so we said, well, why would that be?
Ridker looked closer and discovered that statins also lowered CRP. So he asked a provocative question. Could statins stop heart attacks in seemingly healthy people with low cholesterol, but with signs of inflammation in the form of CRP?
We randomized almost 18,000 patients around the globe. Their cholesterol levels were very low at baseline, but they all had high levels of CRP, and we therefore knew they were all at high risk for having a future heart attack or stroke. Well, fast forward several years later, there's a 50% reduction in heart attacks, 50% reduction in stroke, and about a 20% reduction in all-cause mortality by giving a cholesterol-lowering drug that we know lowers inflammation to people who don't have high cholesterol. That was a real breakthrough. Statin drugs, the drugs that we think of as cholesterol-lowering drugs, are sort of twofers. They both lower cholesterol and they lower inflammation. And many of us now think that the reason these drugs are so effective is because they have beneficial effects on both of these systems, which seem to interact with each other to really deal with aggressive heart disease.
The study was funded by the same company that makes the statin Crestor, and the results and methods were not without controversy. So Redker is going one step further to prove his theory. He's testing an anti-inflammatory drug that's been used for years to treat another ailment entirely, arthritis.
And it was noticed many years ago that people who took this drug for arthritis seem to have lower rates of heart disease. We're giving the drug to patients who've had a prior heart attack. They don't have arthritis. And we're asking the question, if we lower the inflammation, will we in turn get fewer heart attacks and fewer strokes? It's a very exciting study, and it's up and running right now in the US and Canada.
Billions have been spent in research labs around the world to try to stop the heart attack crime wave. But meanwhile, in a tiny isolated village in Italy, a medical mystery, a mutation that not only stops but reverses heart disease.
I thought it was a 1 in a million chance, and I was absolutely stunned when it worked.
HDL, Italian style. Italy is in the top 10 when it comes to longevity. The Mediterranean diet has been given much of the credit. But here in the north, in the tiny resort town of Limone sul Garda, there is another secret that has been extending lives. It's a secret that was discovered by Dr. Cesare Sirtori when he encountered a patient who broke all the rules. A man with high LDL, or bad cholesterol, and virtually no HDL, the good cholesterol.
Usually males have an HDL cholesterol about 40. He had 7. So it is something a little bit weird, scientifically, something unexpected.
Put simply, he should have been dead, yet his arteries were clear. Just what was keeping him healthy? Dr. Sirtori and his team spent years looking for an answer until another clue. There's a protein component in HDL that helps it do its job clearing out bad cholesterol. Tests on the man and his family revealed that it had been genetically mutated. On a hunch, Sirtori went searching for more clues in the patient's hometown, Limone.
So in Limone in 1981, we screened the whole population. And our major concern at the time is, say, suppose I go there, I draw 1,000 samples of blood, I don't find anyone. Elide is a historical figure for me because she was the first diagnosed gene carrier in Limone. And after 30 so years, every time I see her, it's sort of a shock for me.
Dr. Sirtori screened 1,000 people and found 40 with the same genetic mutation and no heart disease, even though they had very low HDL.
This is a very peculiar exception. Of course, one could ask questions, say, why here? Why here? It was never found anywhere else.
Sirtori suspected that the largely Mediterranean diet eaten in this isolated community was not enough to answer his question. A search through the church records traced the mutation back to a couple who married in 1750, and their descendants were long-lived.
So it's a single mating couple. This part of the lake was isolated. There was no inroad from Milan or other towns nearby, which meant this community is inbred. People marry to each other, cousins, and so forth. And this is why the mutation was saved so well over the centuries.
Salute! Could the mysterious HDL these people have preserved for generations help unlock